Hi, this is Megan Tarvis, and I'm going to share a little bit about me. A few facts about me. My track is in the Women's Health Nurse Practitioner. I recently got certified in electronic fetal monitoring on December 21st, 2023. I currently work in a women's health hospital, and their requirement is to get certified in this fetal monitoring. So it was a little achievement of mine recently. Like I mentioned, I work in the women's emergency department that specializes in all OB/GYN emergencies, oncology, antenatal, intrapartum, and postpartum patients, as well as med-surg patients. Any woman with any underlying health issues that comes in with chest pain, possible appendicitis, or GI issues. What do I like to do for fun outside of work? I enjoy going skiing. I actually have a ski trip in a few weeks that I plan on going. Some self-care things I like to do is shop, unfortunately, especially on Amazon. I also like to go get some facials here and there. And one of my other favorite things to do is to travel to new, exciting places. My next trip is going to Aruba with one of my good friends. And last year, I recently went to Nashville, as well as on a Caribbean cruise and Florida. And I also want to talk to you about prenatal care, as prenatal care is very important. It's when you go to your doctor's appointment and they monitor you throughout your pregnancy and make sure there are no high risk disorders, or make sure everything is good, or monitor anything that's high risk. Prenatal care basically reduces maternal and infant mortality, so basically death rates. We don't always talk about those, but they do occur due to the lack of prenatal care. An interesting benefit to prenatal care is that we monitor your iron levels during pregnancy when they take your blood to detect an iron deficiency. If there is a deficiency, which is very common in pregnancy, we will provide iron supplementation throughout your prenatal care. This improves outcomes for yourself with your own blood levels, and as well as cognitive function for your future baby, and throughout their life it affects. And we can also, providers in our field also support and incorporate all cultural and ethnic practices within prenatal care to avoid any health disparities. We know health disparities are, unfortunately, can be common in pregnancy and can lead to the inability to receive prenatal care due to that. But this is something providers continuously are concerned about and work to ensure that there is no gap in culture ethnic practices. A study I found was the Sudanese culture. They have beliefs that affect their pregnancy and baby. So one of those is the inability to consume meats, which can lead to anemia in pregnancy, like we talked about. So providers need to think of ways to incorporate this into their care and prenatal care, and not show judgment or anything like that, and find ways to communicate throughout there with the patient and family. So it is important to attend all prenatal visits, as well as communicating with your provider. And that is my presentation. Thank you.